Hi everyone, welcome to today's class Paragonimus westermanii. This is probably the last class of the helminths section, and the worm Paragonimus westermanii belongs to the trematodes phylum of the helminths. The adult worm, lives in the lungs, and hence it is also called as the lung fluke. My objectives for today's class are as below. After the session is over, you should be able to describe the morphology of the worm and the egg, modes of transmission and the habitat of the worm, clinical features, laboratory diagnosis, treatment and prevention. So these are the objectives of my class. Coming to the introduction, the worm Paragonimus westermanii is a trematode. You know the classification of helminths. Helminths are classified into the platyhelminthes and the nemathelminthes. Platyhelminthes are those which are flat. Platy is for flat. Platyhelminthes, where the class cystodes and trematodes are there. And you have the nematodes class, that is where the worms have a body cavity, they are cylindrical. So about the cystodes, about the nematodes, you have already learned. We will be learning about the trematodes now. So the trematodes, they are leaf-like and they are unsegmented. So they are leaf-like, they are flat and they are unsegmented. So comparison to the cystodes, which have segments in their body, the trematodes, they do not have segments. The sexes in trematodes, they are not separate, that is they are hermaphrodites, meaning male and female worms, they are present in the same worm, that is the male reproductive organ and the female reproductive organs are present in the same worm. They are not separate, that is they are hermaphrodites or monoecious. They have got suckers, hooks are not there, like in case of Tinea. Alimentary canal, it is present but incomplete, meaning that anus is not there, and body cavity is not there in case of the trematodes. So this is about the cystodes, nematodes and the trematodes class. So how are the trematodes classified? Trematodes are classified into the blood flukes depending on the habitat of the adult worm, classified into the blood flukes comprising of Schistosoma hematobium, Mansonia japonicum and all, liver flukes or hepatic flukes or biliary flukes like Clonarchis, Opistharchis, Fasciola hepatica and all, intestinal flukes like Fasciolopsis busci, Heterophyes, and the last, that is the lung flukes which live in the lung, that is Paragonimus westermanii, which is today's topic. So that is the classification based on the habitat where the adult worm lives. Coming to the morphology of the adult worm, so you have seen that the worm is a flat, leaf-like. So that is how it is, flat, leaf-like. If you look at its digestive system, it starts with an oral sucker and a pharynx, and a ventral sucker is here. Ventral sucker is big, so big it looks like an opening in its body. So that is the reason the This class of the helminths are called as the trematodes. Trema is for opening in the body. So that is the reason they are called as trematodes. That is the ventral sucker. That is the digestive system. So this suckers are the suckers are there, and this is the pharynx. But you can see here the digestive system ends abruptly with a cecum. There is no anus. It ends abruptly. So that is the reason it is called as incomplete digestive system. Then you have the excretory system. Excretory system is well developed. It has got flame cells, these black dots, which are draining into the excretory bladder. And then you have the reproductive system, which is also well developed. It has got ovary, the testis, and the worm is a hermaphrodite. That is, it is both the sexes are present in the same worm. Coming to the relative size of the adult worm, as you can see here, it is around 10 millimeters. 10 millimeters is around 1 centimeter, which is fairly visible to the naked eye. We can see it with our naked eye. 10 millimeters or 1 centimeter. It is a flatworm. The size of the trematode egg. So in this diagram you can see that it is around, this is the scale, 10 microns. So it is around 50 microns and maybe around 70 to 80 microns here. And this is the chart. In this, as per this chart here is the Paragonimus egg, and it may be around say 40, 50 or 40 to 50 microns and into around 80 microns. That is the size of the Paragonimus westermanii egg. The adult worm, as already said, it is flat leaf-like. Here it is, and this is the schematic diagram of the adult worm. So the same thing, the diagram: oral sucker, the ventral sucker, and ovary, testis, and all other things are there that you have seen. So it is around 1 centimeter in size. So after the adult worm morphology, you are supposed to know about the morphological forms of the larva. Right? So 5 larval forms are there. One is miracidium, and sporocyst, radia, cercaria, and metacercaria. So these are the 5 larval forms of Paragonimus westermanii. So these are the, you have seen about the adult form, and you have seen about the larval form, and this is the morphology of the egg. Egg is around 80 to 55 microns in size. It is oval. It is yellow brown color. It has got a thick shell, you can see that, and it has got a operculum. You can see that operculum is a flap like structure which upon pressure opens up like a cap, and it has got that shoulder which is protruding. You can see that operculum with the shoulder is a typical feature of the eggs of trematodes. That is the morphology of the egg. So you have seen the morphology of the adult form, larval form, and the egg. Coming to the geographical distribution, as you can see here in the red areas, India also it is there, and also in the Southeast Asia. The geographical distribution. Life cycle, the infective form is the metacercariae. Here is the metacercariae. It is a metacercariae in the improperly cooked crustaceans. Crustaceans means those which have shell, like shellfish and the crab. So infective forms are the metacercariae in the shellfish and in the crab, which are not properly cooked. The Paragonimus westermanii totally has got 3 hosts, 2 intermediate hosts and 1 definitive host. Intermediate hosts are those which harbor the larval form of the worm, that is snail and the crustaceans, they harbor the larval form. Man harbors the adult form, and hence man is the definitive host. Right? So man harbors the adult form in the lung. Coming to this life cycle diagram, this is from a CDC website. It starts from here. Stage 1, unembryonated eggs. So unembryonated eggs are passed in the stool of the person or in the sputum of the person who is infected, and this is the diagnostic stage. As you can see there, D is for diagnosis. You can see here in this legend, you can see D is for diagnostic stage. So we see the eggs in the stool or in the sputum and we diagnose the case. Right? That is the meaning of this letter D. So this is stage 1, unembryonated eggs. So these reach the water body and get embryonated. That is, embryo is formed within those eggs. So this embryo, meantime it hatches and it releases the larval form, the first larval form, that is the miracidia. It is stage 3. So these miracidia, they can freely swim in the water body and they reach the snails. That is their first intermediate host. And in the snails, it undergoes all these forms: 4A, 4B, 4C, sporocyst, radiae and cercariae. All these forms, the worm passes through all these stages in the snails. And the 4C form, that is the cercariae, they penetrate the snails and they come out and they infect the crustaceans. Crustaceans are shellfish and the crab. They infect them and they get encysted to form metacercariae. Right? You can see I here, I meaning infective form. I here, see the legend here, I is for infective stage. So this is the infective stage for man, that is the metacercariae. So man gets infection here in the 6th stage by eating inadequately cooked or pickled crustaceans containing the metacercariae here. After that, the 7th stage is here. So the metacercariae have reached the lungs, the stomach and then the duodenum. They get existed in the duodenum and then they penetrate the intestinal wall and they reach the peritoneal cavity and then they pierce the diaphragm and they reach the lungs, the larval forms, that is the metacercarial forms. So in the lungs here, the stage 8 is there. In the lungs, they mature into adults and they reproduce, they produce eggs. Eggs are again passed in the feces and in the sputum. So this is the life cycle. So you can see here, this is metacercariae are the infective form. The snails are the first intermediate host and the crustaceans are the second intermediate host. Man is the definitive host. So this is the highlights of the life cycle of Paragonimus westermanii. So some more additional information is here. The lifespan of the worm is around 5 to 6 years. So if you are easy with this diagram, you can remember this diagram. Some more information is here. Man gets infection by eating the drunken crab, that is, which is eaten raw. It is not cooked. So the metacercariae are there and they are not cooked and man gets infection by that route. Even wild boars are infected. Tigers also may be infected. That is, they are the natural hosts for that Paragonimus westermanii, and man is also one of the hosts, maybe incidental host. Coming to the clinical features, the adult worm has reached the lung. That is there in the lung. It manifests as discomfort in the chest. That is because it's a foreign body. It causes problems with the respiration, causing discomfort in the chest. Cough because of the inflammation. Hemoptysis, eosinophilia, and pleural effusion. It looks like tuberculosis clinical features only. If you remember tuberculosis, where there is a cough, hemoptysis is there in the tuberculosis also, discomfort may be there in the tuberculosis, so it presents like a tuberculosis only. It is one of the very important differential diagnosis for pulmonary tuberculosis, Paragonimus westermanii. So this is because of the adult worms in the lung. Adult worms in the intestine, they cause pain, bloody diarrhea, and abdominal mass. Some complications may be seen. Multiple lung cysts may be formed. The cysts may get secondarily infected by some other bacteria, causing bronchitis and abscess. Then chronic pulmonary abscess may resemble tuberculosis, and some ectopic sites may be affected, like CNS involvement may be there, causing epilepsy, paralysis, optic atrophy, papilledema, and even skin also is one of the ectopic site. Lab diagnosis, specimen are the stool and the sputum. You have seen that in the life cycle chart of the CTC, the diagram was there. You can see, you have seen that the diagnostic stage was there. In the stool and in the sputum, eggs are excreted. So we are choosing those specimens. Specimens are the stool and the sputum. And in the stool and the sputum, we are demonstrating the eggs of the Paragonimus westermanii. So this is the Paragonimus westermanii egg. The size 80 into 55 micron, oval, yellow brown. It has got a thick shell and it has got a operculum with a shoulder. That is the diagnosis of the worm infection. Serology also can be used. Antigen and antibody can be detected, but it is usually not useful for the diagnosis purpose or the treatment purpose. It is for the retrospective evidence. It can be used. Incidentally, the worms may get calcified in the lungs, and those also can be detected in the X-ray of lungs, or even other radiological investigations like a CT, ultrasound, MRI can all detect the worm, a calcified spot in the lungs. Coming to the treatment, praziquantel is the drug of choice. Bithionol also can be used, and in some cases surgical removal of the worms may be required. In case of pulmonary lesions or cerebral lesions may be there, it may require surgical removal of those worms, or the calcified spots may be there may be necessary to remove them. Prevention, sanitary disposal of the sputum and the feces, because they are the source for other healthy individuals. That is how we prevent. Control of snails. Treatment of cases, that is there again sources. And health education about properly cooking the food and all. There is an interesting video in the YouTube. It is a documentary in the Animal Planet.
Get delicious antibiotic-free chicken delivered straight to your kitchen. Download the Fresh to Home app now.
This program contains material of a disturbing nature. Viewer discretion is advised. Doctors have just discovered microscopic eggs.
There is a documentary in the Animal Planet. You can see that. Questions expected from this chapter are general features of Paragonimus westermanii, diagrams of the adult worm and the egg, life cycle, clinical features, lab diagnosis, treatment and prevention. Thank you.